All right, so you know those super satisfying videos of like pressure washing gunk off a driveway?
Yeah, I've seen those.
Kind of mesmerizing, right?
Yeah.
Well, in a way, that's what our kidneys are doing 24/7, filtering out waste products from our blood. And when those filters go in the fritz, that's what we call acute kidney injury, or AKI for short, which I'm sure you've heard of.
And the thing is, it's way more common than folks realize, especially in critical care. You're looking at 30 to even 60% of those patients experiencing AKI.
Whoa, 60%. That's wild. Definitely not something to take lightly. But I got to say, figuring out who's actually got AKI, that's not exactly a walk in the park, is it?
Not always, no.
We lean on those creatinine levels and urine output, but they can throw us for a loop sometimes, can't they?
Absolutely. It's like imagine if you were trying to, I don't know, diagnose what's wrong with your car, but you only looked at the exhaust coming out and how much gas it was using.
Yeah.
You're missing a lot of what's going on under the hood, right? Creatinine and urine, that's just a tiny peek into a much bigger picture.
So, gotta pop the hood and get our hands dirty, so to speak.
Yeah.
And this is where those biomarkers come sweeping in, like the cavalry, right? I've heard of this NGL. And TIMP2IGFBP7.
Yeah, TIM2IG FBP7.
Those are like giving us a direct line to what's happening inside the kidneys
Yeah.
before things get really out of control.
Exactly. They're like those little sensors, those alarm bells going off within the kidneys themselves, telling us, hey, something's up here, before those old school markers even budge.
So what's the deal with these biomarkers? Like, how do they actually work their magic?
So NGAL, for example, that's a protein, and it gets released by those injured kidney cells. So if we're seeing high levels of NGAL, it's like spotting smoke from a mile away. It's a clear sign that there's a fire somewhere.
Okay.
And then you've got TIM2IGFBP7. Now that one, that's a mouthful, but it basically tells us about cellular stress. It's like those kidney cells are waving their little arms saying, help, we're overwhelmed over here.
It's amazing this whole hidden language inside our bodies that we're just now starting to crack the code on.
Right. And what's really cool, TIM2IGFBP7, that's been FDA approved to actually predict severe AKI. So that's a big deal.
Wow, that is huge. So we're talking about identifying those at risk before things spiral.
Exactly.
But it's not just about fancy new lab tests, right? We've got technology jumping into the mix too.
Oh, exactly.
Something about a furosemide stress test.
Yeah. So basically, we give the kidneys a bit of a challenge, like a little nudge.
A nudge with, like, a medication.
Yeah, we use a diuretic, furosemide. And then we watch really closely to see how they handle it. This gives us valuable info about whether things are going to get better or, unfortunately, worse.
So it's like we're testing the kidney's resilience in real time. Not just waiting around to see what they can handle, but kind of poking them a bit to see how they'll react.
That's a great way to put it. And then, get this, we've got artificial intelligence entering the scene now, too.
Oh, here comes AI to shake things up again. What's AI doing in the world of kidneys?
So picture this. Algorithms sifting through a patient's medical records, spotting those subtle early warning signs that even the most seasoned doctor might miss.
AI connecting the dots that we might not even know are there. So we're talking about personalized risk scores, kind of like those weather apps telling you there's a 30% chance of rain, except, way more consequential.
Exactly. It's all about early identification so we can intervene before it's too late.
Which is always the goal.
Yeah.
Early detection, better outcomes.
Right.
But here's the kicker. AKI, it's not a one-size-fits-all kind of thing, is it?
Not at all.
It's not like saying, oh, you've got a headache. It's way more nuanced than that.
Yeah, it's more like saying headache, but there are, different types, different flavors, different ways it can play out.
And that takes us to the world of AKI phenotypes, which we'll dive into right after this. All right, so AKI phenotypes. It's like we're categorizing these different, species of AKI, right?
Yeah.
Each with its own little quirks.
Yeah, I like that. It's a good way to think about it. You've got your transient AKI, which is kind of like, you get a quick cold. It's annoying while it lasts, but then poof, gone. Kidney function dips, but then bounces right back.
Okay.
No lasting harm, thankfully.
And then on the other end of the spectrum, you've got persistent AKI. That's the nasty cold that just won't quit.
Exactly. Kidney function, it's down for the count.
Yeah.
And that's when we start to worry about those long-term impacts.
Makes sense. And somewhere in between those two extremes, we've got this new kid on the block, acute kidney disease, AKD. What's AKD all about?
So AKD, it's like that bridge, that link between those short-term AKI episodes, the transient ones, and chronic kidney disease, which, as you know, that's the long game, what we really want to try to prevent.
Okay, so AKD is sort of bridging that gap between acute and chronic.
Exactly. It's a shift in how we're thinking about AKI. We used to see it as this, temporary thing, but now we know it can be the first step on a much longer road.
So understanding these different flavors of AKI, that's key to figuring out how to approach treatment, right?
Absolutely. We can tailor our strategies based on whether it's a quick hit and run or something that's more entrenched.
Makes sense. Targeted treatment for a more precise diagnosis. I like it. But before we go too deep into treatment, I think we got to zoom in a bit, get down to the nitty-gritty.
Sure.
Our listeners, they love to know the how, behind the what, what's actually happening at the cellular level when someone's experiencing AKI.
Oh, it's a whole world down there. Imagine, like, inflammation, cells freaking out, energy shortages. It's a mess.
A mess. All right, well, let's try to untangle it a bit, shall we? We talked about how AKI is really common in those critical care settings, and we know sepsis is often a major play. A lot of folks think it's just about, blood flow to the kidneys, taking a nosedive, but it's way more complicated than that, right?
Way more. Think of it this way. Your kidneys are like a busy city,
Yeah.
right? Lots of traffic, things moving in and out, and then sepsis hits. It's like a massive earthquake ripping through that city.
Okay.
And I'm not just talking about a few cracks in the pavement. I'm talking the whole infrastructure is shot. Those tiny blood vessels, the capillaries, they're like the network of roads, and
Yeah.
they're all jammed up. Can't get those vital supplies, the oxygen, the nutrients where they need to go.
So it's not just about the volume of blood, it's about how efficiently it's actually moving through the kidneys.
Exactly. And to make matters worse, now you've got the immune system, right? They're like the first responders rushing in to help, but sometimes they get a little carried away. Start releasing all these inflammatory molecules that are basically like, I don't know, wrecking balls, tearing down those already damaged buildings, the kidney cells.
Oh, man. It's like the body trying to put out a fire with a tsunami. And on that note of things being overwhelmed, what about the mitochondria? Those little powerhouses we always hear about. What's happening to them during all this?
Mitochondria, yeah. They're like those little energy factories, keeping those kidney cells going. And when they're damaged, well, it's like the lights go out. No more energy, no more function.
So is there any way to, jumpstart those mitochondria, get those lights back on?
That's where the research on this NAD comes in. It's kind of like, I don't know, like giving those factories a backup generator.
Okay.
NAD, it's like that extra fuel they need to keep chugging along. We're still in the early stages, but it's exciting stuff.
Always love to hear about a potential lifeline for those struggling cells. But we've got inflammation, energy depletion. What other tricks do those clever little cells have up their sleeves to survive AKI?
Well, sometimes when things get really hairy, the best move is just to, hit the pause button. And that's where this whole cell cycle arrest thing comes in.
Cell cycle arrest. So they're literally just stopping in their tracks.
Pretty much. They stop dividing, which conserves energy and prevents further damage. It's like everyone just stay home, hunker down, and wait for this thing to blow over.
Smart. But is there a downside to that?
There can be. If it goes on for too long, it can actually hinder the repair process.
Ah, I see. So it's about finding that sweet spot between protection and recovery.
Exactly. And that's why biomarkers like this CCL14 are so interesting. They seem to be able to predict which AKI cases will resolve quickly and which ones will become more persistent.
It's like having a crystal ball to see which patients need a closer look, maybe a little more aggressive intervention.
Right. Yeah.
This whole personalized medicine thing is really taking center stage. But hey, we've talked about all these internal factors, but what about stuff coming from outside the body? Medications, for example.
Yeah.
We all know meds can be lifesavers, but they can also have a dark side. And when it comes to the kidneys, we call that nephrotoxicity, which, I'm not going to lie, sounds a little scary. We'll unpack that right after this. All right, so nephrotoxicity. It sounds kind of ominous, doesn't it? Like something out of a medical thriller.
It does have a certain ring to it, but really it's just a fancy way of saying a medication is harming the kidneys.
Right. And it's not like every drug is out there gunning for our kidneys.
Yeah, not at all. Some meds, they can directly damage those kidney cells, that's true, but others it's more like they mess with blood flow, or maybe they build up to toxic levels if the kidneys are already struggling.
Okay, so a whole range of potential offenders, some sneakier than others. What are some of the big ones, the ones that always raise a red flag?
Well, contrast dye is one. The stuff they use for CT scans and MRIs.
Yeah. Yeah, the infamous drink this chalky liquid. Not exactly a party in a cup.
Right. So we used to be really worried about contrast-induced AKI, but the good news is the risk is actually lower than we initially thought, especially with the newer contrast agents they're using these days.
That's a relief. So does that mean we don't have to worry about it as much anymore?
Well, I wouldn't say don't worry. There's always a risk, even if it's small. And it's still a judgment call for the doctor, weighing the benefits of that scan against that potential risk for each patient.
Always a balancing act,
Yeah.
especially when we're talking about those essential medications like antibiotics. I know some of those can be tough on the kidneys.
Yeah, that's a tricky one. We need those antibiotics, right? They're lifesavers. But some of them, like vancomycin, it's a bit of a double-edged sword. Can be really effective, but you gotta watch it closely.
Vancomycin, that one always seems to come up in these discussions. What's the deal with that one?
Well, it has what we call a narrow therapeutic window, meaning the dose that knocks out the infection, it's pretty darn close to the dose that might start causing kidney problems.
Oh, I see. So it's about walking that tightrope, getting enough to be effective, but not so much that it causes harm.
Exactly. And that's why they're always monitoring those vancomycin levels in the blood, making sure they stay in that sweet spot.
Precision dosing, gotta love it. What about those, like, last resort antibiotics, the ones they bring out for those superbugs? Polymyxins, is that what they're called?
Yeah, the polymyxins. Those are like the big guns. We only use them when absolutely necessary. They can be life-saving, don't get me wrong, but they do carry a higher risk of nephrotoxicity. It's about weighing the risks and benefits in those really tough situations.
Right, when you're battling a superbug, sometimes you gotta take a calculated risk.
Yeah.
Well, this whole discussion about nephrotoxicity, it
Mhm.
really underscores something important about AKI, doesn't it? It's not just a kidney problem.
Exactly.
It's like this domino effect
Yeah.
impacting other organs and systems throughout the body.
It's all connected, right? When those kidneys aren't filtering out the trash, so to speak, it starts piling up everywhere, causing trouble in other neighborhoods.
And it's not just about those toxins building up, right? AKI can mess with the immune system too.
Oh, absolutely. It weakens the defenses, makes you more vulnerable to infection. It's like you're already down, and then AKI comes along and kicks you while you're down there.
Not cool, AKI. Not cool. So we've got potential long-term damage, increased risk of infections. What's the overall outlook for AKI survivors? What are the chances of things going back to normal?
It's really a mixed bag. It depends on the person, how severe their AKI was, their overall health. Some people, they bounce back completely, but for others, it can be a long road.
So even if someone's kidney function seems to recover, there can still be lingering effects.
Potentially, yeah. Even after they've seemingly recovered, they might be at higher risk for chronic kidney disease down the line, heart problems, other complications.
Man, that's sobering. So what can we do? How do we help those AKI survivors stack the odds in their favor?
Well, awareness is huge, making sure those AKI survivors are getting that follow-up care, keeping an eye on their kidney function, managing blood pressure, all that good stuff. And then, of course, there's research. Always research.
Got to keep pushing those boundaries. Well, we've covered a ton of ground in this deep dive. We've talked about how we diagnose AKI, the challenges, the promising new tools. We've dug into the nitty-gritty of what's happening at the cellular level. And we even touched on those medications that can sometimes do more harm than good.
Yeah.
But if there's one big takeaway I want our listeners to walk away with, it's that AKI. It's not just about the kidneys.
Right, it's a whole body issue.
Absolutely. And
Uh-huh.
understanding those connections, that's where the real breakthroughs are going to come from.
I think so too. The more we learn about how AKI impacts the entire system, the better equipped we'll be to prevent it, treat it, and help people live longer, healthier lives.
Couldn't have said it better myself. All right, that's a wrap on acute kidney injury. We'll be back next time with another deep dive into the world of health and medicine. Until then, stay curious, my friends.